What are lung capacities in breathing? Have you ever wondered how much air your lungs can actually hold? Understanding lung capacities is key to grasping how our respiratory system works. Lung capacities are measurements that show the total volume of air our lungs can hold during different phases of breathing. These capacities are made up of various lung volumes, which representing specific amounts of air involved in the breathing cycle. Let's break down the basic lung volumes first. The tidal volume is the amount of air we inhale or exhale during normal, relaxed breathing. For an average adult, this is about 500 milliliters. Next, we have the Inspiratory Reserve Volume. This is the extra air that can be forcibly inhaled after a normal inhalation. Then there's the Expiratory Reserve Volume, which is the extra air that can be forcefully exhaled after a normal exhalation. Finally, we have the Residual Volume, the air that remains in the lungs after a forceful exhalation. This volume helps prevent lung collapse and keeps the tiny air sacs, called alveoli, open. This is usually around 1,200 milliliters. From these volumes, we can derive lung capacities by adding specific volumes together. The inspiratory capacity is the total volume of air that can be inhaled after a normal exhalation, combining tidal volume and inspiratory reserve volume. The functional residual capacity is the volume of air left in the lungs after a normal exhalation, which includes expiratory reserve volume and residual volume. Vital capacity is the maximum amount of air that can be exhaled after a maximum inhalation. This is a combination of inspiratory reserve volume, tidal volume, and expiratory reserve volume. It reflects the largest volume of air that can be moved in and out of the lungs. Lastly, the total lung capacity is the total volume of air in the lungs after a maximum inhalation, which is about 6 liters for an average adult male. These capacities are essential for assessing lung health and function. They indicate how well the lungs can ventilate and exchange gases. The mechanics of breathing involve muscle contractions, mainly from the diaphragm and thoracic muscles. These contractions change the volume and pressure within the thoracic cavity, allowing air to move in and out of the lungs. During inhalation, muscle contraction increases thoracic volume, lowering pressure inside the lungs and drawing air in. Exhalation is usually passive, relying on muscle relaxation and elastic recoil to push air out. Measuring lung capacities is important in clinical settings. It helps diagnose and monitor respiratory diseases, evaluate treatment effects, and understand the functional status of the respiratory system. These measurements reflected the combined function of respiratory muscles, lung tissue elasticity, and airway resistance, all vital for maintaining gas exchange and homeostasis.